Hello students, I am Dr. Leena Meshram. I am working as assistant professor in Mahatma Phule A.C. College in the Department of Zoology. In this video lecture series, today we will talk about a very simple concept, and that is volume of blood. Yes, we all are very curious, we all are very eager, like what should be the volume, a normal volume of blood in an adult or an healthy individual. What should be the normal volume of blood? Is it 5 liters, 10 liters, what it should be? So when you talk about the total volume of blood, you can see that this is the test tube having blood in it, which is centrifuged. Okay, so when you say the human or the adult, how much blood the healthy person should have, approximately it should be some approximately it should be 8%, 7 to 8% of the body weight. It should be 7 to 8% of the body weight. That means if a person is 100 kg, the person is 100 kg, the blood volume should be 6 to 7 liters. Okay. Now this blood, when you see or when you centrifuge it, it will be distinctly seen in two different layers, that is the sediment, or you can see whatever is settled down, it is in the formed element, and whatever is supernatant, it is the plasma. So 55% will be the plasma and 45% will be the cells which is present in the blood. Okay, so the blood will have 45% of the cells and 55% of the plasma, in which the 55% plasma, there is 91% of water and 2% of solutes, which will involve the proteins, very important proteins, then ions, waste products, nutrient, gases and all the other regulatory substance. So it involves 2% of it and 91% will be water. Whereas in the formed element, or we say blood cells, so there will be WBC, RBC and platelets. So RBC will count for 4.2 to 6.2 millions. Then WBC some 5 to 9,000 WBCs per ml of blood, and platelets it will be 2 to 5 lakhs of platelets. Okay, so when you see the volume of blood, the total volume of blood, the volume of blood consists of near about 7% of body weight. 7% of body weight. So here you can see there are two different ways to designate or to express the blood volume. In relation to body weight, as I told you, and then in relation to the body surface. The blood volume can also be calculated in relation to the body surface, that is 3.3 liters per square meter of the body surface. So how will you define blood volume? The total blood volume is the total amount of blood in the circulation, the total amount of blood in the circulation, as well as the amount of blood which is stored as a reservoir in the spleen. Okay. So total volume of blood is the total amount of blood which is there in the circulation and the blood which is also stored as a reservoir, that is in the spleen. There are two ways to calculate the blood volume, one in relation to the body weight and the other in relation to body surface. When you say body weight, it is 7 to 8% of body weight, and when you say body surface, it is 3.3 liters per square liter. Okay, now this blood volume doesn't remain always constant. Okay, for example, if a person dehydrates, the blood volume goes down. Okay, so there is always a variation in blood volume under different physiological conditions. Now these are certain factors which will tell you when the blood volume goes less or where the blood volume goes more. For example, age. Infants will have higher blood volume. When you compare an adult and an infant, the infant will have greater proportion of blood than the body weight. Sex. In men, blood volume is 7.5% higher than that of the women. So when we say blood volume is 5 liters in women, it will be 5.5 liters in case of men with the same weight. So it is 7.5% higher in case of women than in men, and that is because of the larger number of RBCs in case of men. Men will have 5.5 to 5.6 million RBCs, whereas female will have 4.5 to 5.5 million RBCs. So you can say in case of men, the blood volume will be higher than female. In case of pregnancy also, there will be rise in the blood volume. Okay, during pregnancy there will be rise because of the increase in the plasma and the cells. You can see that there will be rise during the pregnancy period. There will be rise in the blood volume, and it will not remain the same after the delivery of the child. The blood volume will fall to the normal blood volume. Okay. The fourth factor I would say is the blood pressure. Rise in blood pressure will lower the blood volume. Rise in blood pressure will lower the blood volume. Why? Because the blood will be pressurized into tissue spaces. They will be pressurized in the tissue spaces. The next factor is altitude, where you can see that there will be increase in the blood volume. Excuse me. At higher altitude, when one person goes to a higher altitude, there will be rise in the blood volume. Anoxia produces again the same cause. There will be rise in the blood volume. When there is adrenaline rush, so when you are talking about the variation in blood volume, these are physiological conditions in which we have seen that there will be rise in the blood volume. Age, in case of infant, the blood volume is higher than that of the adult. In case of sex, men will have higher blood volume than the female. In case of pregnancy, the female blood volume will be more due to the rise in the plasma and the cells. In case of blood pressure, the blood pressure will lower the blood volume. Why? The blood will be forced to enter into the tissue spaces. Higher altitude will have rise in blood volume. The condition anoxia, where there is less amount of oxygen, there also the blood volume will increase. And in adrenaline rush or adrenaline injection, there will be rise in the blood volume. Okay, so these are the other physiological conditions where you can see that there will be rise in blood volume. Now there are again variation due to decrease in blood volume. There will be decrease in blood volume. Now there are certain conditions where you can see that there is decrease in blood volume. The first one is hemorrhage. Hemorrhage, where you can see that there is loss of blood. There will be loss. It can be an arterial loss, it can be a venous loss, or it can be a capillary loss. So when there is a wound, there is a traumatic condition, accidental condition, there can be a loss of whole blood. Okay, so hemorrhage, where I said it is a condition when there is loss of whole blood. So there naturally there will be decrease in blood volume. Then there is a condition called as anemia. Anemic condition where there can be decrease in RBC count, which will result into the decrease in blood volume. Then there is plasma loss in certain conditions, like in born person, or when there is when the person donates blood, the plasma can the blood volume can go down, or even a person can donate plasma alone. So when the loss of plasma is there, the blood volume can go down. So loss of blood, or you can say anhydric conditions, when there is dehydration, there is loss of body water, where the blood volume can go down. Acute exposure to cold can cause moderate loss of blood. Even the posture is responsible for the decrease in blood volume. That is, blood volume is low when you are in erect position than in the lying condition. Increase in blood volume, I told you, high temperature, muscular exercise, emotional excitement, pregnancy, congestive heart failure, administration of certain hormones like aldosterone. These are certain factors which are responsible for the increase in blood volume. Okay, so in today's lecture we have talked about the blood volume, the total blood volume of an adult in adult condition. Total blood volume of adult condition, it is nothing but the whole blood which is present in the body. It may be about 4.5 to 5 liters of blood, and this whole blood is flowing into your arteries and veins, and then it is also there as a reservoir in the spleen. So I hope you understood the concept. Thank you.